We will start fundamentals of public health management. In this session, we will be learning two important areas. The one is public health and the second one is health management. What exactly is public health? For a general understanding, public health is about improving and protecting the health of groups of people rather than about treating individual patients. Look at the big picture and then take action to promote healthy lifestyles, prevent disease, protect, and improve general health. There are some definitions of health. Let us see what CEA Winslow defined in 1920. Public health is the science and art of preventing the disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitation of the environment, control of communicable community infections, education of the individual in principles of hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, development of social machinery which will ensure to every individual in the community standard of living adequate for maintenance of health. The Institute of Medicine in 1988 defined as an organized community effort to address the public interest in health by applying scientific and technical knowledge to prevent disease and promote health. Conceptual evolution of public health. First, it started as the disease control phase in 1880 to 1920. Then we entered health promotion phase in between 1920 and 1960. Then we got into social engineering phase between 1960 and 1980, and lastly health for all phase 1980 onwards. This is how the evolution of public health. What are the public health activities? Very briefly, we can say it is related to prevention of epidemics, protects the environment, workplaces, housing, food and water, monitors health status of population, mobilizes community action, responds to disasters, assures quality, accessibility and accountability of medical care, reaches out to link high risk and hard to reach people needed services. And lastly, researchers to develop new insights and innovative solutions. Leads the development of sound health policy and planning. Who are these public health functionaries? Are they very important? We have to know them. What are their functions and responsibilities? Are they useful to the community at large? In this public health functionaries, we will be listing out various number of public health leaders and how they have to play the role in preventing the diseases. Regarding core public health functions, we have three very important. One is assessment, the second is policy development, the third one is assurance. In each of these areas, we have number of public health functions which are divided into different areas. So what are these? Knowledge and skills, public health domains, managerial skills and leadership. These are the essential areas in public health. And these are essential public health functions. As I told you earlier, we have three dimensions. One is assessment, the second one is policy development, The third one is assurance. And this requires a detailed description of each area. So that's why I have given simple diagram to tell you what are the essential public health functions under core functions. Okay? Yes. So the assessment means we are going to monitor the health and we are going to monitor the health problems. And when do you call a health problem? Monitor to health identity and solve community health problems. As I told you, health problem is related to health conditions of the individual. Whenever the problem is defined, it will become a health problem. Then assessment, we have to see the diagnosis and investigation of the diseases. And then what is community diagnosis? When we call a community diagnosis is possible to investigate the disease and diagnose and investigate health problems and hazards in the community. Is the important area for assessment of the disease. Then once we assess the disease, we have to have policy development. We have to have inform people, we have to educate, we have to empower people to get into what is called as health promotion. And once they develop health promotion, we have to empower the community, and this is the stage of policy development. Then mobilize community partnership. Government alone cannot implement all the programs. We have to have social mobilization and partnership, and mobilizing community partnership to identify and solve the health problem. That is the purpose of social mobilization. And we have to develop policies, different type of policies, health policy, population policy, nutrition policy, That's the reason why we have to have policy development and plans to support individual and community health efforts. Very important stage. Then assurance. Once we develop policy, we have to enforce laws to provide the required services in the form of various legislations. We have a number of legislations to see that. So it is not just having regulations and legislation, we have to enforce them to protect the health and ensure safety of the community. That is one purpose. Then assuring link to provide health care. And as I told you earlier, it is not just policy development, we have to develop health care, linking how, when, where you establish linkages in providing health care. So that is linkage is very, very important. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. So assurance is very, very important to providing services and assure competent workforce. To provide the services, we have to have a very good competent workforce. And who are these personnel? What are these? How they should be? What is competency? And assuring a competent public health and personal health workforce is very important to provide the services. Then evaluate. Once we provide the services, we must be sure that whether the services are being accepted or not. So what is evaluation, what is effectiveness, and what is accessibility and quality. All these are very important in terms of providing the services. And we evaluate effectiveness. We have to find out whether it is accessible, whether the right quality of services are being provided, and personal and population-based health services. These are all very, very important in finding out what is happening in the providing the services. Then finally, research, because as research for new insights and innovative solutions, we don't have a right answer to every solution. So we should know something about how to conduct research methodology in public health to find out new insights and innovative solutions. So that is what is core functions and essential public health functions. Then we come to the second portion called health management. It is defined as purposeful utilization of resources effectively and efficiently towards achieving the objectives of health organization. This is the standard definition for health management. Your utilization should be purposeful, and you have got different type of resources. We have effective services, efficient services, and what is the objective? Totally achieving the objectives of the health organization. But that's the purpose of the health management. Okay. So development a management model. To understand better, we can examine what is called as management model. I will show you the diagram. See that we have the inputs in terms of resources, and we have the process conversion of all inputs, and we have the outputs or the outcomes. Let us see what are the inputs. We have man, money, material, knowledge, skills, time, motivation, mobility, technology. These are the inputs into the organization. Once these inputs are given into the organization, whether it is at the state level or at the district level or at the taluk, PHC level, the process starts. This is called as magic box, where we don't see the process going on, but we will see the outcome. The outcome in terms of safe deliveries, malaria prevention, smoking stopped, epidemics prevented, spraying undertaken, accidents avoided, mother and child immunized, malnutrition prevented. So remember, these are the inputs and this is the outcome of, and that is what is management. Conversion of inputs into outputs or outcomes effectively and efficiently. That is the management model. This is a very good model, and one can understand very clearly what management works in the organization, particularly health organization. And we are going to, as I told you, we have to clearly understand what is effective and what is efficient. This is very commonly being used, but if you ask what is effective, what is efficient, very difficult to spell out very clearly. Both are important for the health organization towards achieving the goals. You both health manager should be not only effective, he should also be efficient. So let us examine in detail course what is effective and efficient. Okay. That is ultimate objective is reduction, and then know what are health problems. And once we know that,